At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Putting Your Best Foot Forward on Wednesday, April 29th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle Live, and we got another great program for you, ongoing to inform you of how to help your life. And that's why we call it Ageless Health, just so you can understand that your health should be an ongoing ageless presentation to allow you to do whatever you want to do when you want to get it done, right? Some of us can't do that. So what do we do about it? Well, we're going to start with the bottom up today. What am I talking about? Is your feet. Your feet can reveal all kinds of bad things that are going on in your body. And I want to start going into that. And we have a very special program that's coming up, and it's going to be done on, I guess, about a week and a half from now on the 29th of April in office at the Roselle Center in Fairfax. And why am I talking about special? Well, first of all, the presenter, Dr. Harlan Browning, by the way, who'll be my guest next week when we do this program. Many of you know him as the professor. He's amazing. And he's going to talk about your feet. And he's going to talk about feet as it relates to your health, all kinds of things from numbness and so forth. But we're going to get into things like, circulatory problems and how they show up, and nerve damage. We call it peripheral neuropathy often. Diabetes that shows up in the feet, thyroid problems that show up in the feet, nutritional problems that are causing other systemic irritations. So, and we want to know whether the swelling that you have is cardiovascular. We want to know the swelling that you have has to do with your kidneys. All of those things show up on your feet, and you really need to know. So we're going to get into that just a little bit today and then expand upon it on the 29th of April, coming up very rapidly. Please join us. All you got to do is give us a call at 703-698-7117 or go to the website, go to rosellcare.com. That's ROSELLECARE.com, rosellcare.com, and register for the class. Let us know that you're coming, and so we can prepare for you, that we know that you're gonna be with us. And by the way, if you can't make it, you know what the drill is, right? Just call us the day before and say, hey, something came up, I can't make it. But these classes are for you. But let's get into the program a little bit. But get this, your feet are one of the first telltale signs of something that's not right in your body. It can be very early signs of systemic. That means all of you health issues. And we just talked a little bit about, touch points like nerve damage and circulation and so forth and so on. So let's go through them just a little bit and see if any of these tweak you. But, the more important thing is, if you find the problem, then can you do something about it? And these are the things that you need to, educate your doctors on, make sure that they know as much about it as you do. So common foot signs, we'll go with that. So cold feet. How many of you have cold feet? You put socks on at nighttime, even when it's 90 degrees outside. Yeah, there's some of you that actually do that. Persistently cold feet, even when it's warm like it is right now, it indicates a circulatory problem. It could be peripheral artery disease and things like Raynaud syndrome or diabetes or very significant hypothyroidism. It reduces the blood flow, so you can't warm up. But you got to know what it is that you're treating. And it's not just throwing a drug at it. It's a matter of figuring out what to do to reverse to get your health back. And that's what we're going to do on the 29th here at the Roselle Center. Dr. Browning and I are going to talk about this. He's going to really walk you through. You know, when I say this guy's a professor, this guy's got more data, more knowledge in between his two ears than most computer systems do. You will enjoy the presentation. Next week when he's on with us, I'm going to kind of tweak him a little bit, and we're going to really get into some of the nitty-gritties on this. But what happens if you have swelling? You know, is the swelling throughout your entire foot, or is it in the ankle by itself? Is it up above the ankle? Where it is and how it responds tells you where it may be a problem. Okay, so what do I mean by that? So swelling without a clear cause, should be something that you need to go get checked like yesterday. I mean, all of a sudden swelling shows up and you got these big, bananas on your feet. So that's a problem, my friend, because it could be a clot. And if it's a clot, you're going to be in real trouble, right? So swelling that just kind of shows up without any clear cause, you got an issue. But swelling can be everything from cardiovascular disease, or it can be kidney. Now, if it's just the foot and it doesn't go up into the ankle, that's where it starts. That's often a kidney sign. And it's just kind of these big dogs that get, really swollen. And if you really want to know why it's there and not other places, well, one of the reasons is the energy platform for the acupuncture system. Kidney starts at the bottom of your foot. So everything gets, they'll call it stagnation. It just kind of dams up, and you end up with these big old swollen feet of yours. So it's just the feet. Now, if it goes up a little higher and you're into the ankle and maybe into the lower portion of the bottom of the leg, and you can put your finger into it and it leaves a divot, that's often cardiovascular, and you can't mess around with this. One of the signs. So when I see a patient like that, what I'm going to look for is that divot, where the swelling is, particularly first. And then I'm going to look at their tongue. If the tip of the tongue is red, if their earlobes have a longitudinal line in it, it tells me it's cardiovascular. At that point, I say, get thee to the hospital and let's get some things figured out really quickly, because we're courting a major problem here. But you can tell so much by looking at the type of swelling. And we'll get into that as well. We're going to show you the things, but more importantly, what can you do about it? Sometimes kidney problems are nothing more than you're not drinking enough water and you don't put enough salt. Yep, I said salt. Salt is really good for you. Now we're not talking about table salt. We're talking, table salt is sodium chloride, and that can cause swelling in of itself. But if you use something like pink salt, Himalayan salt, if you look something like Baja Gold, as BAJA Gold, and get online, that's good for you salt, and you should be having a little bit of that every day in your diet, even though that your doctor says, no salt because you have a problem with blood pressure. It's not going to cause a problem. The sodium chloride, table salt, will cause a problem, but not the full Monty, if you will, the different types of salts that have all the different things. Sea salt's okay, and it has a lot of really good things in there for you. But here's the problem with sea salt. It depends on what part of the ocean it comes from. It can be polluted. You're going to get some of the pollution there. You're going to get some of the heavy metals. You're going to get some of the poisons that they put in the area. So you got to be really careful with things of that nature. Let's talk a little bit about, your heel. What happens if you look at your heel and you got cracks in your heels, right? One of the first things to look for is thyroid problems. Heels that crack and are dry are often thyroid problems, or they can be poor circulation, as we talked about as well. They can also indicate infections like fungus, particularly, right? So cracked heels, you got to start ruling out thyroid first, fungal problems, and poor circulation. Now, if I want to do a rule out, if you will, kind of interesting terminology, if I want to look at that type of thing relative to fungus, what else I can look at? I'm going to look at the nails themselves. If I got these really thick, yellow, toenails, and actually they don't have to be really thick. They can just be thicker than they've been for a while, and they start lifting. They don't seem to be laying down as well as they should. That's a number one indicator that you may have a fungal condition. And there's ways of getting rid of that, obviously. And here's the deal. Most people, most doctors think that the fungal problem originates in the nail bed, and it's not true. Your body has to be aware, meaning it has to have a biochemical platform that will draw that mold, that fungus, and make it a home for it. And it begins to grow and begins to cause the nail to look very horrible. You can go online and say, toenail fungus, and look up images on, Dr. Google, and you're going to see some things that are going to turn your stomach. But that's inside. So what do you got to do to get rid of it? You got to treat the whole body. You can do things if they're starting. You can do things with Clorox. The old-fashioned Clorox. Take 8 ounces of water, warm, just warm, not hot, not cold, but kind of room temperature, and put 2 tablespoons per 8 ounces, 2 tablespoons measured equally for 8 ounces of water in a bowl, and put your foot in it every night for 20 minutes while you're watching the tube or doing whatever you're doing, and do it for a month. In most cases, it will destroy the localized fungus. But you still got to take care of the body. So what are you going to do with that? Remember that fungal patterns grow with what? They grow with dairy products. They grow with sugars. They grow with fermented foods and things like wines and beer and like that. You got to drop the sugar load. You got to drop the fermented products as well. Otherwise, this stuff's not going to go away. And if it's on your toes, you start doing a body check and you start seeing loss of pigmentation in other parts of your body. That's telling you got a mold problem inside. And if you have a mold problem inside, you have an immune function problem as well. So we want to walk through that. But here I gave you something that you can do, right? 2 tablespoons and so forth. Now, there's other things to do. One of the other things to do is just get yourself to the health food store, go to Mom's or someplace like that, and ask them for Pouty Arco tea. It's also called Tehibo. It's also called Lapacho. It's also called Ipsiro. It's the same thing, basically. And it kills mold inside the body. Make 3-4 cups of really strong tea and drink it for 4 to 6 weeks every day, and a lot of water, and do the things I just told you about. You get rid of a lot of that nonsense. Now, what happens if you're not, you used to grow hair on your toes, right near the joint spaces, and now nothing, the lower leg, now nothing. That's often vascular, it's poor circulation. And then pretty soon your feet start getting numb and tingling, and somebody's telling you got peripheral neuropathy. When you're dealing with a peripheral neuropathic problem, you've got to check circulatory pathways in addition to everything else. It can be coming from your low back. It can be a diabetic problem, but it also could be blood supply. And you have to look at all those things and rule out each one of them. Now, how can you do that yourself? Tell you what you do. Take a pin, like a safety pin, and open it up, and then gently stroke it on your foot. And see if you can distinguish a soft, sharp touch from something that doesn't feel like much of anything. Take the tip of it and just gently, don't stab yourself with it, but just gently touch the foot. If it doesn't feel sharp to you, you've got a neuropathic problem. You have a peripheral neuropathic situation straight up, and it still could be there, but that's one of the primary indicators. If you were in my practice, you were seeing me and you were complaining about bad feet and your feet were numb or tingling, or I can't feel them like I used to, the old-fashioned pizza cutter, we call it a pinwheel, would come up, and I would drag that gently across your skin surface. Is one of the tests of several others that I would do to see if your sensory pathways were working the way they're supposed to. Now, all the things that we're talking about can be reversed. It can be made a whole lot better. Now, are there sores or ulcers that are persistent on your feet? That's way straight up diabetic, neuropathic problems and blood supply. It causes destruction, breakdown, ultimately gangrenous conditions, and you're going to lose your toes and your feet. So you can't ignore that kind of stuff. You have to really understand it and get it done. The colorations, the blue, the purple, that's also restricted blood flow. Feel your feet. Is it warm? Is one side different than the other? You can have a problem in one foot and not have it on the other side. So, but you have to be able to distinguish it. How do you distinguish it? Touch it very lightly. Feel both sides. See if it's different. Measure your foot gently. You can do just with your hand, or you can actually take a tape measure, because sometimes the swelling is very low level. How about, you're walking around and your foot hurts, your big toe is throbbing, and there's a lot of heat to it. What do we got? Well, guess what we have to rule out? Primarily gout, and it's going to hit your big toe more than anything else. And then it can go to other areas within the toe. It'll go to your knee, and it works its way throughout your whole system. But it's a systemic condition. It's one of the first kind of finger pointing, early warning signs that says, hey, you got a problem here. And if you ignore it, you got a bigger problem. The beauty of gout, that is a liver function problem, is that it's reversible. You can fix this if you're willing to clean up your act. And we're going to show you how to do that. We're going to show you what happens when your low back is out of position. Why is that important? Because all the nerves that go to your feet come from your waistline, and if you got back pain, guaranteed at some point you're going to have feet problems, you're going to have leg problems, you're going to have that kind of stuff. But the feet, if you want to think about it this way, are the furthest extremities from the heart. Your heart's up in your chest, feet all the way down there. And they make them very sensitive indicators of nerve function problems and metabolic problems and cardiovascular problems and so forth, if you know what you're looking for. Now, regular foot checkups, if you will, are important. When a patient comes into my office and they've been a patient of mine for a long time, they come in and say, hey, listen, I'm here for a wellness check. I said, take your shoes and socks off. Why do I do that? Simply because I want to see the indicators that may be subtle, that may be telling me that I have some other issues that are going on. Now, regular foot checkups also look at footwear. So I'm going to look at people's shoes. I'm going to look at the bottom of them. I'm going to say, will you start getting rid of these bad things? And, well, I love my shoes. And I said, no, you're cheap. Go buy yourself a better pair of shoes. There's a lot of sales online. You're on your feet mostly all the time. And if you don't have the right support, when I'm home, my shoes come off. When I come home, my socks come off. And I'm walking around barefooted. I'm doing different things with my feet. I'm grabbing things with them. And it's just a habit I've gotten into over time. But what I do is I'm trying to stimulate neurological function. I'm trying to upregulate a lot of signaling to the rest of my body. But observing changes in skin and nails and sensory patterns and the size of your foot can lead to saving yourself from other things that are far more dangerous and more devastating if you catch them soon on. You look at those toenails, and are the toes lifting? Are they getting discolored? Fungal problems, mold problems in the body are a systemic immune depletion that is causing it's telling you that your gut microbiome is not working the way it's supposed to. It's going to cause you all kinds of inability, if you will, to protect yourself from other things that are going on. So I would encourage you, I would highly suggest, if you will, that you need to be your own doctor. I've told you repetitively, my book that I wrote years ago, which is in the process right now being rewritten, Ageless Health, Health is a do-it-yourself program, was written simply to finger point the issue. Look, you need to make sure that you are your own doctor, not somebody else. You're the primary care provider for you. You can determine what's going on. But here's the deal. Once you know, are you willing to change anything? Once you know, are you willing to break the habits of sedentary lifestyle? Once you know, are you willing to eat food that is fresh and wholesome and actually prepare it yourself? God forbid, right? So I don't know about you, but I care enough about me that I want to make sure that I have everything that it takes so I can continue the process of moving forward. Now, there was an interesting article, and I'm always giving you articles that I want you to refer back to. And this one goes back to actually quite recently. It was December 25th. I'm going through my notes right now, trying to make sure I produce it. But anyway, it says, what your feet say about your health. And, we talked about a lot of it just a minute ago, but changes, the things that you really have to be aware of, changes in sensation and temperature, are finger pointing and say that you got a problem that's going on. You may have nerve damage. You may have a diabetic pattern that you're not paying attention to. You went to the doc and the doc says, well, your A1C hemoglobin, you're in that pre-diabetic state. You're about 5.8. And they said, you have to do things. They're going to put you on different medications, and they're going to try to get this thing squared away that way, but they're not handling the problem. But the loss of sensation that progresses to numbness and then the inability to stand on your feet is associated with many different things, but it can be uncontrolled blood sugar. Now, why is it only a pre-diabetic state? Because they're not doing the other testing. What's the other testing? So how about something called LDH? LDH is a liver enzyme. Tell your doc, say, hey, my blood sugar is like 105. You told me it's not terrible, and I'm in a pre-diabetic state. And can't we run an LDH to see if, in fact, that I may be going into a yo-yo form of diabetes and back down? It's important. It's a primer. If you come on the 29th at the Roselle Center in Fairfax, we'll talk about that, and we'll tell you why it's important, and we'll tell you how to kind of gently encourage your doctor to run the right tests. But if we're looking, to diagnose things, it's more important to be aware of things before they get to a place where you have to diagnose a very ugly condition that might be gangrenous or something like a wound that's not healing, right? Your nicks and scrapes and so forth, if you're a healthy person, should heal very rapidly. What happens if you start seeing blue colorations in your skin or in the nail beds? That's not okay. You need to see somebody that knows what they're doing. What happens if you got numbness and tingling in your legs and your feet, and you notice that, you have some general aching in your low back, you're getting up really slowly, you get on your feet and you don't have the sensory patterns. You're kind of walking like flat-footed because you don't know what your body's trying to tell you, that you might fall down. Well, you might fall down, but you have to put these things together. As we get into next week's program with Dr. Browning, we're really going to get a deep dive in this. I'm going to let him, the professor, if you will, tell you some things that you may not have thought about. It's really important that you understand what you're looking at, and don't let anybody tell you, let's watch it. Well, what are you watching? Why would you watch it? Why can't we say this is going on, and hey, Mr. Jones, Mrs. Anderson, if you don't do X, Y, and Z, this thing is going to progress. In many situations, it's because they don't get it. They don't understand it. If you have a nail that's pitting and there's small depressions in the nail surface, it can very much be an autoimmune disorder. It could be a psoriasis, because that's how it shows up. Pitting in the nail bed, and lines that are deep furrowed and cracking are one of the indicators that may. How about things that are associated with lymphatic drainage and chronic respiratory system? If you have those deep lines and you don't know what's going on, check your breathing. Take a deep breath of air in, particularly right now with all the allergy reactions that are going on. You've got to do something about it. Look, we're going to go into the podcast pretty quickly, and a lot of you get it because you're signed up with us. You go to rosellecare.com or drtomroselle.com and check it out. And by the way, if you go to the website, we've got a toolbar that says Ageless Health. And if you go into it, there's a place called Full Script. So any of the things that we talk about here, that if you're not patients of ours, you can get online, because that's the way to go get it. I want you to get well. Look, we're coming up to that place where I got to say, we're going to be here next week, but I want you to remind you, April the 29th, call the office, register. You can do it online at Roselle, rosellecare.com. Do it right now. Don't hesitate. I want to see you on the 29th. See you soon. Remember, I'm here all the time for one reason only. I love you all. Have a great Sunday.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Putting Your Best Foot Forward on Wednesday, April 29th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.